Hi everyone, good morning. My name is Raj. I'm working as a research assistant in Biosystems and Food Engineering. Today I'm going to present our study, which is on quantitative human health risk assessment of lead through the environment and food chain. Next slide, please. Lead is a global problem, taking life of 500,000 per year. Lead can be present in the bedrock, and weathering process releases this metal from the rock to the soil, making it available for the plant's uptake. So therefore, the objective of this study was to quantify the level of lead arising from the background and the anthropogenic sources, to develop a probabilistic farm-to-farm human health risk assessment model, and to identify prominent exposure pathways and polluted controls to reduce this risk. Next slide, please. The background concentration of lead in soil and water was collected from the Taylor's.I project, which is publicly available. The land use used was arable land from the Corin Habitat Map from EPA. These concentrations were added to the lead level in biosolids, which were collected from the local county council of the study area. These concentrations then further multiplied by the bioaccumulation factor of the selected crop products, such as potato, carrots, cabbage, and lettuce. Why these products only? Because these products are eaten with minimal modifications. The consumption of these food products were taken from the Irish University's National Nutritional Allen Survey, and multiplying with this daily consumption, the concentration of PP in food can give us the daily human exposure to lead. Monte Carlo simulation approach was used for this probabilistic model, and the mean human exposure then further compared with the hazard quotient, daily dietary index, daily intake of metal, health risk index, target hazard quotient, and cancer risk. Next slide, please. Our result shows that mean daily human exposure to lead is 0.073 mg per day. And the methods shows the values where the HQ, HRI and THQ was below 1. DDI was below 0.03 mg per day. DIM was below 0.0004 mg per kg body weight per day. And cancer risk was below 1 into 10 to the power minus 4, therefore showing a low risk. If grown on sites with elevated lead concentration in soil, the intake of potato can be a most sensitive parameter of this model. A back calculation was done to check what is the maximum allowable concentration of lead in soil corresponding to the lowest observed adverse effect level of lead, which is 0.0012 mg per kg body weight per day, and we found it is 51 mg per kg in soil. The blue dots in the map shows the elevated concentration of lead in soil, and we found that 90% of the arable land in Ireland is below this 51 mg per kg level, showing a low risk. Selective crop production is required in those areas where the concentration of lead is higher, because some root crops has the higher affinity to assimilate lead. And biosolid application can be restricted to those areas where the elevated concentration of lead is found.
Could you it's just 3 minutes now, just over 3 minutes, so finish.
Next slide, please. Thank you very much for your consideration, and I would like to thank our funding agency, EPA, and Geological Survey of Ireland.